Hi, I'm Dr. Sabrina Shah-Desai, an aesthetic oculoplastic surgeon based in London on Harley Street. Now, as an oculoplastic surgeon, under-eye rejuvenation using fillers is one of the most popular treatments I offer, along with other non-surgical modalities. And this is one of the commonest concerns I see in my patients who are presenting to me to look less tired and to restore the under-eye area. Now, restoring the tear trough so that it looks natural can be quite challenging because every under-eye or tear trough ages differently. But I'd like to summarize the key factors or the key aging changes that occur in the tear trough. And there are skin changes where the skin is becoming thin, crepey, wrinkly and hyperpigmented. There are soft tissue changes, so that means that we're losing the fat just under the skin and then the underlying deep fat which lies over the bone. And therefore, as we get older, and this sort of process of this aging occurs from your late teens, you begin to get a hollow around the eye area. And then around your mid-30s, we start losing bone, and so we start losing fat pads, and therefore you get a chronically tired appearance from hollows and darkness under the eyes which extend down into the cheek. And this is where using non-surgical rejuvenation with hyaluronic acid fillers is so popular. So let's talk about what can be done to improve the under eye. Now, under eye fillers take 10 minutes to perform. My go-to product is Redensity 2. I also use another product called Restylane Vital Light, and I have a published trademark treatment called Eye Boost, where I use this product and I reserve it for certain types of under eyes. So not all under eyes are made equal, not all under eyes respond to under eye fillers, and one needs to be very careful about assessing tissue quality and the tautness or the tightness of the skin. So the younger you are, the deeper the hollow and the tighter the tissue quality, the better you do with under eye fillers. But you need to do subtle treatments, and these are typically in Hispanic, Indian, Middle Eastern patients where they present early with a hollow under the eye. These patients also need a skincare plan to treat the pigmentation that they have. These are ethnic dark circles, and so I give you advice, and I have a specially formulated under eye cream that helps reduce the under eye hyperpigmentation in the skin and brightens the under eye quite gradually. Now, the older you get, you're going to run into trouble with under eye fillers, particularly if you have a large eye bag or you have tissue laxity or loose skin. And this is where you really need to be very judicious about the choices you make, and sometimes you only need to restore the mid-face and avoid the under eye area, so no under eye fillers. But you could have under eye fillers if you have surgery and we've got rid of the large bag or tightened the skin with either surgery or non-surgical energy-based treatments like laser, Tixil or Morpheus 8. So tear trough fillers can be quite challenging, and we need to manage the patient expectation. Often I tell people that you need to factor in a little bit of social downtime because you may be bruised and you can be swollen. These are called common treatment responses, and you can see the filler. It can be a little lumpy or bumpy because eyelid skin is so thin and the anatomy is really compact and very, very close to the bone. But over time, so a couple of weeks after the treatment really settles because this gel, the hyaluronic acid gel, takes some time to settle. Now, I hope this little video has answered some of your concerns or questions about having under eye fillers. If you have any further questions, please don't hesitate to visit my website, which is a lot of information, and don't hesitate to contact my team at Perfect Eyes Limited. I look forward to seeing you.